Welcome to a special episode of Beyond the Roundup. On today's show, we're going to briefly discuss a Rhode Island bill proposal that up until now has mostly flown under the radar. In it are fines and double taxation for those who refuse to get vaccinated against COVID-19, which in essence makes those who don't get vaccinated in the state second-class citizens. We're going to discuss what in the world is going on here. And so, from Trial Site News, I am Adrian, and our episode starts now. So, in Rhode Island, Democrat Senator Sen Bell introduced a bill that would in effect create two classes of citizens within his own state: those who accept the vaccine and those who don't. The bill, if ever signed into law, would cause Rhode Islanders who don't get the COVID-19 vaccine to face $50 monthly fines and double what they would normally owe in personal income taxes. It would require every eligible person who is at least 16 years old and lives, works, or pays personal income tax in Rhode Island to be immunized against COVID-19. And it would require every eligible resident under 16 years of age to be immunized against COVID-19, with the responsibility for ensuring compliance falling on parents or guardians. Under the bill, anyone found in violation may present a signed petition of exemption to Department of Health. Petitions must be signed by 3 licensed physicians stating that the person is not a fit subject for immunization against COVID-19 for medical reasons. The bill would also require employers to provide proof of compliance for any employee working in person within the state, although employers may choose to waive proof for purely remote work. Any employer found to be knowingly in violation of the law for more than 7 days would have to pay a monthly civil penalty of $5,000. According to an article in the Boston Globe, Senator Bell said that the reason that he introduced the bill was that we have a crisis with the pandemic. Thousands of Rhode Islanders have died. I've had really painful calls from constituents who can't go to the store because they're immunocompromised, who have lost loved ones to this pandemic, who are really ill and not fully recovered, suffering long-term effects. And when addressing the backlash online, he talked about his 4-month-old son who has interstitial lung disease, which places him at high risk for serious illness or even death if he gets a respiratory infection. Senator Bell said about his son that his condition has made me feel more compassionate and ready for the heavy level of abuse I knew I'd receive. I love my son more than I can put into words, and the idea of him not being able to interact with people and go to school, those things terrify me. And I'm not the only parent of a child with a serious immune condition. Now, Senator Bell also cited a Boston Globe report on a survey that found that Rhode Island ranks 6th in the nation for residents who support a universal COVID-19 vaccine mandate, saying that with Dan McGowan reporting that Rhode Islanders still strongly support a universal vaccine mandate, despite the McKee administration pushing hard for the surrender policy, it's time for us to pass my mandate bill. Cases are rising again, surrender isn't working. So, as of filming of this episode, the legislation has been referred to the State Senate Health and Human Services Committee after it was introduced. However, there has been no action on it since. Also of interest, according to the WJAR, State Senators Jonathan Acosta and Tiara Mack, who originally co-sponsored the bill, have now removed their names in it. There has been no public explanation as to why they've done so. Meanwhile, De La Cruz, the Senate Minority Whip, who recently dropped out of the 2nd Congressional District race, wrote an email to her supporters on the issue saying that, "I have not, nor will I ever support legislation that coerces Rhode Islanders into making medical decisions or face steep financial damages. I hear my constituents and others around the state loud and clear. This is dangerous legislation and sends the message that our government doesn't trust you to make the right choice for you and your family. This is an unconscionable overreach of legislative powers." She went on to say that the good news is that the bill stands little chance of becoming law, but that she isn't taking it for granted, and cautioned her supporters that neither should they. It is also worth noting that President Joe Biden's administration, which implemented a federal vaccine mandate on employers with more than 100 employees via executive order last year, had the mandate struck down by the U.S. Supreme Court. And that, my friends, brings our episode to a close once more. As always, thank you so much for joining me on the show today. From Trial Site News, I am Adrian, and I will see you all next time.